Hello, my name's Julie McCrossin, and welcome to this series of conversations with people who are working to improve access to clinical trials for everyone in our community. And this series is hosted by the GI Cancer Institute. In this episode, Madison Shakespeare, a Gadigal traditional owner and community advisory panel member with the GI Cancer Institute, AGITG, explains the importance of an awareness of the cultural needs of First Nations patients, the significance of family, kin and community, and why cultural protocol training is essential. Well, it's my great pleasure now to welcome Madison Shakespeare, who's a practicing lawyer and academic, and she works across 3 universities, Flinders University in South Australia, Western Sydney University, and also the Woollatuka Institute at the University of Newcastle in New South Wales, which has a focus on Indigenous education with a global perspective. But Madison, you're a woman who loves life, who's also cared for someone you love with cancer. Welcome to our conversation.
Thank you so much, Julie. It's lovely to be here.
And the artwork behind you, is that an example of your work?
Well, indeed, as a Gadigal traditional owner, I'm very proud to introduce to you Charlie. Charlie brings in the light and is my totem. So Sulphur Crested Cockatoo, the noisy one. And I do mimic aspects of Charlie at times.
Oh, good on you, Madison. Look, let's cut to the chase. This is all about clinical trials. It's about equity, diversity and inclusion. What do we need to do to improve inclusion of First Nations people in clinical trials, and why is it essential?
That's a very big question. There are many questions there. A cancer diagnosis for all patients affects the patient, but often their family and their friends. Understanding that a cancer diagnosis for First Nations peoples affects the patient, but also their family, their kin and community is essential for healthcare professionals. Healing, achieving well-being outcomes for First Nations people is not just about achieving physical outcomes. There needs to be a balance between quality of life, but also a deeper understanding of holistic well-being for First Nations patients. And those well-being outcomes are realised through family, through community, but fundamentally by understanding that we have different cultural needs.
And you believe those cultural needs have to be understood and supported in the clinical trials context, but you can't support them if you don't understand them.
Absolutely.
I mean, would you go so far as to say cultural education, cultural training is essential for multidisciplinary healthcare teams in cancer?
It's fundamental, absolutely fundamental, because having a deeper understanding of cultural concerns, not just fears of unknown treatment, unknown procedures, which is certainly something that many, all I would think, grapple with when entering, moving from that position of cancer diagnosis to hopefully immediate treatment and treatment options. So whenever anybody is diagnosed with cancer, we confront these terrible processes. But for First Nations peoples, we also have other cultural considerations that must be understood by treating professionals, because those cultural concerns can really impact on whether patients will even contemplate accessing treatment.
In other video interviews that I've done about cultural safety and developing cultural protocols, cultural frameworks for cancer patients who are First Nations people, there's been a great emphasis on the clinical trial coordinators working in close partnership with Aboriginal health workers. What are your thoughts about that?
Well, it should be fundamental. So there should be an expectation from all clinical specialists out there and all healthcare providers that you will be treating First Nations patients. And accordingly, if that's the case, then it's essential from an ethical and a cultural perspective, and culture and ethics go together Yes, they morph together. It's integral that indeed any treatment options, any clinical trials that are involving First Nations peoples are founded on culturally appropriate frameworks, protocol, and considerations. And I'm going to be very exact here, that are specific to the communities that are being involved in a clinical trial. And that specificity is really necessary, because when I speak of First Nations, it's plural, because Australia was multi-nationed well before colonisation invasion. And an understanding of First Nations and that specificity, different knowledges and practices, it's essential.